All right, welcome everyone. General Manager Tony Mazzucco here for our weekly COVID update. I am joined this week by Sigal Reese, our Public Health Director. We have some updates to our COVID data as we always do, and we wanted to make sure Sigal was here to be able to answer any specific questions we have and also provide some updates. I am broadcasting from a different location than normal. We are at the Norwood Light headquarters on Access Road. So those of you who usually join us, if you could, as you always do, just let us know in the comments if the audio is okay and if you can hear the picture and if it's coming through. Just because we are broadcasting from a different place and because we're within a few feet of each other, we're going to wear masks while Sigal is here until we get through at least the portion where Sigal is. So welcome everyone. Hi, Michelle. Usually means that the sound is working and the video is working. So we're going to give everyone just a few seconds to join in, and then we're going to go ahead and dive right into our numbers. I'm going to step off camera for a second to have a little bit of water.
I'll take up the screen.
Okay, I didn't really step off camera as much as I backed up, but just trying to be safe. All right. Hi, Catherine. Thank you for joining us. So we're going to go right into talking about our COVID numbers. But before we do that, I just do want to say two quick shout outs. One, a thank you to Norwood High student Athena Alexopoulos for my mask. She sent this in via way of Chief George Maurice. So thank you, Athena, for my Mustangs mask. I've been wearing this most of the day that I've been in thank you, Nate. Thank you, Nate, for helping us get set up today. But thanking you for the mask, Athena. And also a big shout out to our cafeteria ladies here in Norwood for this shirt, which I think is pretty great. Lunch ladies survived the 2020 pandemic. Our cafeteria workers here in Norwood, our own beloved lunch ladies, have been working every single day of this pandemic since the very beginning. They have not been able to work from home. They have not been able to work remotely. They have been in every single day working and feeding children and families in Norwood. And we're going to talk about some of their programs in a few minutes. So to our COVID updates, what we seem to be avoiding that we don't want to talk about is we are in the red this week. So as you know, for the last several weeks, we've talked about what being in the yellow means. We've dipped into the green, and we have dipped back into the yellow, and unfortunately, we are at red. If anyone wants to look at what our chart looks like, we post this on the health department website every week. Yep. Our average daily case rate by 100. We are up at 8.1 per 100,000, and as we talk every week, that 100,000 is a mathematical number. This is the framework the state set up. We have about 35 cases in the last 2 weeks.
So when I finally ran, so the numbers are always moving around. I think when I finally ran it, we were up at 37, and that would be between October 4th and October 17th. That's the 2-week period. And that's the report that will actually come out very soon. The state will release that report. But we look at the numbers every day. They're constantly going up and down, but anything over 34 cases, we knew we would hit the red because the rate would be over 8.
Okay, so Joe, just to answer your question, I don't know where to buy this mask, but as soon as I find out, we'll make sure to post it. It was a gift to me from Athena Alexopoulos, a Norwood High student, which I'm very appreciative of. It's quickly becoming my favorite mask. So as we said, if we had a handful less cases, we would have still been in the yellow. Of course, anyone who's seen Mighty Ducks knows the Mighty Ducks theory, a quarter of an inch the other way and would have missed completely. 5 cases higher and we still would have been in the red. What does that mean for us being in the red? How do we get there and what does it mean? On the one hand, Sigal, we have seen no discernible data about one specific thing that's leading our numbers to be higher. We don't have any clusters in town. I feel like there's a talk show, but there are no clusters in town or no large clusters in town. There's not a nursing home. There's not one triggering event that we can point to. It's a whole lot of smaller actions. Is that correct?
Yes. So the main grouping of exposures we're seeing are household clusters. We're seeing household clusters. So that's someone gets exposed at work, they become positive, and they go home, and we would expect household contacts to become positive. So we call that a little cluster. What we're not seeing is what some other happens in some other communities are large institutional clusters. So there's been in the news a lot about hockey exposure, where we see full hockey teams with over half the kids or half the team being positive. We don't have a large clusters like that associated with institutions. Other communities might have a prison or a long-term care facility that has a large cluster of cases that really increases their rate. In Norwood, our rate is increased this week in the report, really just because of community spread. We have a little here, a little there. It's not one institution that has a lot of cases.
Now, Sigal, confirm for me, because I want to make sure everyone knows the we've had a couple cases in the schools, as I think everyone is aware. They've put those out there. There's been no transmission in the schools. So those have been cases where somebody has been positive and then it's been found out that they were in school, so the contact tracing took place. Same thing with restaurants. We have not had any cases where anyone has gone into a restaurant and come home and said, gee, I was at restaurant A last night and that's where I ended up testing positive.
Right, and well, first with the schools are doing a great job with social distancing, wearing the face coverings, following all the safety protocols. So when we have had a case in the school, there have been very small number of close contacts associated with school cases. They have been, as far as in-school exposure, there have been cases that have many contacts, but they're because of out-of-school activities. So a big thing with that is we want to remind our students and really everybody, it's just as important to follow the safety standards when you're out of work or out of school. Make sure to follow social distancing, no large gatherings, wear your face covering. Those things are just as important when you're socializing. And then with the restaurants, it's the same sort of thing. The higher risk area in the restaurant is really the employees. They're the ones that are together all day working in tight areas. So that's when we worry about restaurant exposure. But as far as the customer coming, it's not that high risk of exposure, especially if you're keeping small parties and keeping within your sort of household social cluster. Grouping.
And that's actually one of the things we want to talk about is sort of understanding your own risk profile and how many people you're interacting with. For a family of four going to a restaurant versus a family of four eating dinner at their home, the increased likelihood that they would catch COVID at a restaurant is fairly minimal because, again, it's generally the employees who are there. And that's any workstation where people are working very closely with each other. If you think of a kitchen and there's 2 or 3 cooks right next to each other, that's a risk. If you think of a retail store where people are working for a long period of time, it's about that length of risk. And I know the CDC did recently change their guidelines a little bit, and they said, well, a lot of little repeated contacts can add up to a close contact. But that's where maybe I work with you and we're in the same office for 8 hours, and I was never talking to you for more than 5 minutes at a time, but over the course of a day, I went up to you 8 different times for 5 minutes. You would say, well, there's enough there that it might be something. If I were to go out to dinner with 4 people, so there's 5 of us out to dinner, and I've done that once or twice, there's always a risk there, right? So there's 5 people from 5 different households coming together, and there's a certain risk level there. Where do those people go from there? If I go out to dinner 4 times a week with 5 people each time, I'm possibly exposing myself to a whole lot of people. The contact tracing would then be a whole lot of people. If I maybe go out with 3 or 4 people and then don't necessarily go out with different people for the next couple of weeks, you're reducing that overall contact exposure. Is that correct?
Yeah, so it works on the sum of your interactions. So whether it be like you described, the sum of interactions over over a couple days, or one large gathering, which again causes a lot of interaction. So it's that cumulative effect of interactions that creates higher risk. And also what you mentioned about the CDC. So in practice, that doesn't actually change what we've been doing. When we contact trace, it's a thorough interview process, and we make that judgment call. If we think it's not one 10 to 15 minute conversation that we ask about. We ask about your whole day, who you spoke with, where you went, and if we determine that someone would maybe have a couple interactions with you that would add up to 10 to 15 minutes within 6 feet, we would consider that a close contact. That's what we've always been doing. Mm-hmm. So I think it was more just better defining a close contact than really a change in policy.
Great. So one of the questions we got is, it says, hi Tony, wondering if there are more specific lessons learned from recent cases. For example, is there average number of quarantine contacts for each positive case? And the answer to that is there's really not an average number. Usually, I guess it really depends on how many people you interact with. If you have 2 people in your household and you go to work, and at work you generally only interact with 3 or 4 other people, and then maybe you went out to dinner once a week with one other couple, you're looking at maybe 7 or 8 contacts. But if you've got 5 people in your household, you've gone out to dinner twice, and going out to dinner is safe, of course, but if you've gone to a movie with 2 other couples, and then dinner with 2 other couples, and then you went apple picking with somebody else, and then in the workday you interact with 10 or 15 or 20 people closely, you could have a lot of contacts. Do we have an average number? It's probably only a handful, but it really depends on how much you're out and about. I know in March when I had to, when I tested positive and they had to start quarantining people for me, they were jokingly calling me Typhoid Tony because there were so many other people I had been in contact with. But at the time, if you think about it, I, in a 3 or 4 day period, had attended a number of meetings, which I always do. So each meeting had 5 or 6 people, and then in and out of different town hall offices and town departments. So I had a particularly large number. There are some people where they test positive and we're only quarantining 3 or 4 people, and sometimes it's the immediate family member. So in essence, one of the lessons we've learned is really look at how, knowing your interactions will determine how much you do. So how many people you need to quarantine. Somebody who's an accountant and maybe goes into the office and doesn't really interact with a few people and comes home and they go out to dinner with their husband or wife and then they maybe had dinner with their next door neighbor one night. I mean, it's a handful of contacts. What we advise is you should be aware of your contacts and be aware of where you're going. And if you can, try to mitigate it. I mean, we don't want anyone going to large parties, but let's say you did have to go to a wedding and we know what happens. Let's say you go out to dinner with a couple friends. I've done it. We're all human. How often are you doing that? Because then those people will at some point have to know if you do test positive, not only increasing your risk, but they may need to be quarantined because of you. You may need to be quarantined because of them. So if you go out to dinner with a few people that you don't normally interact with, maybe give it a little bit of time before you start going out again with a whole other group of people. And I know we don't want anyone to have to schedule their social life so detailed, but you go out, I've done it, you go out on a Friday night with 3 or 4 people. Don't necessarily go out Sunday brunch with a couple other couples. And then that Wednesday night, go bowling with a few other people. Just if you're widening your circle, you want to just give it a little bit of time. In terms of lessons learned, we're not seeing spread through people at restaurants. We're not seeing it through retail stores. There's been, not necessarily in Norwood, but in other towns, a little bit of sports spread from hockey in particular, as we mentioned. But it's really about staying home when you're sick, washing your hands, wearing your masks, and reducing your overall interactions. Again, if you like to go out Thursday, Friday, Saturday night, if a husband and wife go out those 3 nights in a row every single week, and you're not really interacting with many people other than yourselves, you're already in the same household, so the risk to you and other people is generally very, very minimal. And thank you, Maureen, for all your support and all the great work that all of our cafeteria workers have done.
Can I go back to when talking about the contacts? So
sure.
Back, like you said, back in the spring when we first started, people had 10 to 20 contacts, and each case was very complex. And then as we shut down, people had much fewer close contacts. Really, it was limited to household contacts. You think about when we were all just staying home. And we've seen that increase a little, and now I would say it varies a lot. We have some cases where there, again, are 10 to 15 contacts, but then we have those much more simpler cases. So I would say that the variation is larger now because people are behaving differently. But like Tony said, the more we can cut down on those close contacts, the better it is. And also that means putting less people in quarantine. I always want to say it's a very severe thing to put somebody in quarantine. And you want to be sure that there's a risk. And like all COVID decisions, it's that risk-benefit analysis. It's a big impact on a person's life to make them stay home for 2 weeks. You can't leave your home for 2 weeks. Barring a medical emergency, you're not supposed to leave the home. And that has big implications on people. So you want to be sure that you know that they are actually at risk for coming down and at risk of exposing others.
A couple other updates as it relates to us being in the red, and then we'll talk specifically about what that means. The state is now going to release their data on Thursdays. We're going to try to pull some of the same data they would release internally so we can continue our weekly Thursday updates. We did get a call from the state today letting everyone know that they officially will be releasing them Thursdays. It's probably out there now. So there's a map, likely that map of communities is coming out either now or in the next hour of what communities are in red. Last week there were 60 communities in red. It's my understanding this week there'll be 73 communities in red. And part of that's a general society is more open, and as a result, the virus is going to spread more. One important thing to remember, the state could have made their numbers a little bit stricter. They could have said instead of 8 per 100,000 being in the red, it could have been 4, and everyone would be in the red. It equally could have been 12 per 100,000, and very few communities would be in the red. So it's a balancing act of, there's no, biological ticker. When you go into red, there's no indication that doesn't cause the virus to change. It doesn't mean it's any more or less deadly. It's just we're getting a number of certain cases per 100,000 people. What we're trying to do in the next few weeks is we want to overlay our data back to March if we can, and we don't always have all the data that we want. But looking at our testing and looking at our tests positive. Again, there are in the last 14 days, there have been about between 35 and 38 positive cases in Norwood. We had 100 in 1 week in April, and then the following week we had another 100. So our testing data is not as available back in April, but we're going to try to look at our testing data from the start of this to now and see, okay, well, we're doing about 150 tests a day. Again, the town is still averaging around 2,500 tests in a 2-week period. So what were we doing several months ago when our numbers were much less? So we're going to try to look at all that and see if it's really that it's spreading a lot more, or maybe our testing is a lot more, or maybe we were testing more back then and the numbers are more of a concern.
So we're going to get the state epidemiologist to give us that data, but I'm going to guess we're testing more and finding less cases. We're back in the spring when we had those 2 weeks of 100 each week, we were actually testing less. So my guess is we've actually probably had more cases. So we're finding more cases now, which is good, right? Because that allows us to do the contact tracing and isolation and quarantine. And with the data, I mean, this is 1 week, and whenever we look at data in public health and trend, we want to make sure it's a trend. So the difference between 33 cases and 35 cases, is there any more risk in the community? Not really, but that's the difference between yellow and red. Now, if we continue to see increases in up and up and up, well, that's a trend, and then we have more risk. But at this point, it's just one jump into the red. Let's see what the future brings. We'll continue to watch it, whether it stays the same, goes up, or goes down. We want to see where the trend line goes.
Right. And we could end up staying in a certain area. We could have this number of cases for quite a while, because remember, every case we get, usually there's another 2 to 3 cases coming along with it, generally if there's a family. Now, not always. As we've said, there are times where one person in a family had a very casual interaction with somebody and they test positive and everyone else in the family ends up testing positive. We've had somebody have a moderate case of COVID and their spouse does not catch it. And there's it's the science of disease that sometimes that's going to happen. But usually in a household of 4 or 5 people, one person tests positive, give or take a week or so, you're going to have a couple more positive cases that come out of that, but they're usually already in quarantine anyway. So dad catches COVID, it tests positive, mom and the kids are already quarantined. You may get 2 more cases after that, but they've already been quarantined. They may need to then go quarantine some other people as a result of that.
One thing we're really trying to do, and the state is asking us on the local level to really put in an effort to try and identify those clusters. So try to identify where people were exposed and what sort of activity led to that exposure. So we can, as a society, as a state, look around and develop policy around it. And I keep bringing up the hockey example because that's just a great example where we're seeing some across the state. So there's conversations about policy around hockey and how we can make that safer. So it's very difficult on the local level. Sometimes you don't know where your exposure came from or where you were exposed to it. But we are trying to better link across communities and across the state and identify clusters in places that people are being exposed. But like I said, it does get hard because it's all just personal interviews and discussions with the cases.
And the lessons learned, just to go back to this question, so a few people per case, but there's no real, an average would only be a statistic average. The lessons learned are that it's the sum of your decisions, but it comes down to personal decisions. Wearing PPE, washing your hands, and not going out when you're sick. Those good decisions generally lead to a lower level of spread. And it's really, in some ways, it is as simple as that. It's just understanding where you are and what you're doing, and the better we can be about it, the better we can function. I mean, other than certain sporting events and things like certain spas and steam rooms, society's mostly open. People are out at restaurants. People are inside at restaurants. They're outside at restaurants. Schools are in session. We've been in session for several weeks now. Catholic schools have been in session in person for now going on 2 months, 6 weeks or so. And when people make wise decisions, we notice that there's fewer cases. Now, the schools are an issue where somebody could go to school sick, and as a result, it could spread in a classroom or spread to a teacher or vice versa. We're not seeing that yet because we believe people are following the rules. So, I know parents are always worried about not sending their kid to school if they think they're sick. And look, full disclosure, I'm sure there was a time or two when I was in high school, I said I was sick and I really wasn't sick and I stayed home. But maybe those are the decisions that we need to make, that there's a heightened risk now. So when somebody says, gee, I'm not feeling well, they should try to stay home. And I know when it comes to work, not everyone has that opportunity. Those of you who are an employer, by all means, this is the time to be flexible with your employees just to make sure we're not taking that risk. And if you have the flexibility to not go places when you're not feeling well, that's what you need to do, because that's when that exposure ends up coming.
I don't know if it's quite lessons learned, but it's also a difference in the situation we are in now versus in the spring, even if we do see an continual increase in the numbers. The cases are also younger in age. I would say our case range, I think the case range of the last 2 weeks was between 10 and 60. I've also started on our weekly reports to indicate the age range in the last 30 days, because when I do these weekly reports, I use the data from all the way back starting in March 1st, where we did see a lot in our older population. And the data now is trending much younger. So younger usually means less severe disease. So while we might see an increase in numbers, it's less severe disease, less hospitalizations. we also have more surge capacity with our hospitals, so that we're in a better condition there. And as far as the local health departments, here in Norwood, we have additional staff now. We have our new public health nurse, which is fantastic. But also we have the support of the Community Contact Tracing Collaborative, which is the state agency that's set up to sort of support local health in the contact tracing. So if we do get overwhelmed with more cases, we can send them to the CTC and they can back us up and do the contact tracing. And then we get the data back, the next day in the state reporting system. So I feel like as a state and even in Norway, we have much more capacity and are more ready to take on a challenge.
That's a great point. If you think back to April, you remember when people couldn't find masks, when we were first even starting to wear masks, there was no restrictions on any type of movement or how many people could be in a bar or a restaurant. And locally in Norwood, we didn't know a lot about the disease then. We didn't know what possibly works to treat it. We didn't know how much it spread and what the impact was. And then locally, the first, I would say, 3-4 months of this, the town's health department, who took the lead, was down a person. So our public health nurse position was vacant, and Stacy Lane, who's our assistant director, had to fill in as the public health nurse. So we were down an entire body through the worst of this. We now have not only filled that position, it was just an untimely retirement that happened right before COVID started, but we've also added another public health nurse to the health department. So we are now well-staffed and well-conditioned. We're also familiar with what to do. As sad as it sounds, a case is not a big deal. I don't say it's not a big deal. It's not what do we do? Let's figure this out. We're sort of just doing this. Now, public health has actually done this for probably the last 30 or 40 years in terms of actually doing contact tracing. This existed long before COVID, but we're all much more familiar with it now, and we have more resources than we used to have. We're also, next week, there's probably statistically a good chance we might be in red unless the case number completely drops off. They usually don't vary too much week to week. We saw 1 week where we dipped into green. And I know it's saying, well, wow, we were just in green and now we're in red. We just dipped into green. When we dipped into green, if we'd had one more case, we still would have been yellow. And as you've seen, our numbers do tend, they're on the upswing, but they do tend to go up and down a bit. And every case leads to usually a couple more cases. So we've got to look at a couple of weeks of data and then decide what decisions we make from there. The challenging part is, as we said, we're not seeing spread tied to any particular thing in the community. I know there's always calls to open everything up or shut everything back down. People being out leads to spread, but if you shut a restaurant down, we have not found anything and we wouldn't do that locally, that would be a state decision, but we have not found anything that says people going into that restaurant are more likely to get COVID. It's when you're exposed to more people. In theory, if every restaurant visit in America was just families in a household, there'd be no spread from it, period. So the state would make some of those decisions, but locally in Norwood, nothing changes now that we're just in red. We would look, other than we want everyone to be extra vigilant. Remember, our numbers are going up, so now's the time to be vigilant. It's the time to make sure you're wearing your mask. It's the time to make sure you're practicing social distancing when you can. Be cautious about when you're going out and where you're going. And if it's people you usually interact with, if you have a Friday night, dinner bunch and you always go out, at least you know who you're going out with. And hopefully if that bunch isn't going out with too many other people, it's not that big of a deal. I'm sure a lot of you have done where you're sitting on a deck at somebody's house and there's some space in between everybody and maybe it's only 7 or 8 people instead of, 60 people crowding a deck. The more we can continue to do those things, we can keep services going, we can keep schools functioning, and we can keep the services that we have. We are lucky that at least the case age is dropping, and as a result, the cases appear to be milder. And as Sigal said, we have, although not locally in Norwood, but statewide, the hospital surge capacity is there. That's really the next metric I think statewide that we're going to be looking at is, okay, we know the numbers are climbing, but there is always some presence of every infectious disease in any community. With the numbers rising, how are the hospitals doing? Are they filling up? Is the ICU filling up? Because people who test positive and have a severe case can get treatment. It does improve the survivability rate considerably as long as there's hospital beds available. So everyone remembers back to when we said flatten the curve back in March. If we showed the numbers, we did flatten the curve. And the goal of flattening the curve wasn't that it was magically going to make COVID go away. What it was going to do was prevent those hospital overloads. And we saw those in places like Italy. That's what happened is, the hospitals just overloaded. And even if every case of COVID was mild, when you overload hospitals, those services aren't available for other services needed. So somebody they break a leg, they have a heart attack, they have some sort of other issue, and they just can't get treatment because the hospitals are overloaded. We're nowhere near that right now. And given our numbers and our positive, we're doing well, but that's what we're going to start focusing on, and we believe the state will as well, that, well, let's keep an eye on the hospitals and see how people are doing. If you're sick, you should always get medical treatment, but we can continue at this rate and even at a higher rate with keeping things mostly the way they are if people practice good personal decision making. That's really what it comes down to. We know to wear a mask. We know to do the social distancing when you can. We know to wash your hands regularly. And when you go out with people, make sure it's people you interact with regularly, or if you have a night out with 5 or 6 friends, that's okay. Just try to be cautious the next 5 or 6 days where you, who you're interacting with outside your normal little bubble. Other than that, there's no regulatory changes in Norwood. If we spend 3 weeks in the red, we go back to phase 3, portion A. Is that what they call it? Step one and portion A.
Yeah.
And all that really means is there's some changes for restaurants, but nothing severe. The number of people who can sit at a table go from 10 to 6. They'd probably remove the bar seating, although if there's bar seating with protections, they'd have to look at that. So it's nothing substantial.
Yeah, the biggest thing is the outdoor gatherings would go back down to 50. Right now in step 2, you can have outdoor gatherings up to 100 with face coverings and social distancing and all the safety standards. But that's really the big difference. A lot of it between step 1 and 2 has to do with large performance venues, which we just don't have in Norwood. So I think the biggest implication for us in Norwood will be the outdoor gatherings limit.
Right.
The thing that comes into play is with the weather changing, we may not see it so much, but sometimes at sporting events, kids sporting events, you get up to 50 when you have the 2 teams and the coaches and all the parents watching. That's when the numbers kind of creep up close to 50. So we just want to keep an eye on that.
And that's really all we have for now. We're going to be bringing our data out. We need people to continue to be vigilant. I think given the level of activity in the community, Norwood is actually doing it right, and we are actually doing well. For a community with our particular demographics, because remember that demographics do contribute to spread. You see denser communities, in the lower the socioeconomic spectrum they are, the higher the numbers across the board. Communities like Brookline, which are very dense but are very wealthy, very little spread. So early on, we were sort of an early riser in some ways with COVID, but with so many other communities going red before Norwood, 60 other communities or so, I think it shows that we actually have a slower rate of spread than other communities, given our demographics. I mean, when towns like Westwood and Canton and Dedham all went red long before we did, and some of them are still in there, Milton became red recently, it's an indication, I think, by and large, that people in Norwood are playing by the rules and we're following the rules, because we've not seen any giant spikes. Even this spike here is not really that big of a spike. Now, if next week it's 13 and then the week after it's 18, well, then we got to say, whoa, it's, we need to relax a little bit. But we review the data a couple times a week. Even with the state's changes, we'll be getting out to you. What we need people to do now that we're in the red is what we've been asking people to do since day one. Wear your mask, social distance when you can, try to keep your circle a little on the smaller side, and just be good about when you're not feeling well. Please, please, please stay home and isolate yourself if you can.
And especially with the holidays coming up. We got Halloween right around the corner. I think there's some great tips that the state put out. The one I like is, rather than the big bowl of candy, you maybe use a tray. So everybody's not touching everybody else's candy. Have hand sanitizer out. And if you're not feeling well or you have been exposed to somebody that has COVID-19, if you're in isolation and quarantine, of course, do not participate. Turn off those lights. Do not allow trick-or-treaters. You need to stay home, but you also shouldn't have people over when you're in quarantine. So if you are in quarantine, don't participate. Or if you're not feeling well, don't participate in Halloween. Skip this year.
And if you are in quarantine in Norwood and you need any kind of assistance at all, you can either call our Citizen Information Center, call the manager's office or the health department. We can help you get whatever services you need while you're in quarantine. That's something that we provide for any resident, so you let us know and we'll be able to help you take care of that.
Yeah, our goal is to keep you home and help you do that as best as possible. So if you are in quarantine, contact also the public health nurse that spoke to you, and they can get you any resources you need.
And I guess the last bit of advice is, if you do get contacted by one of the public health nurses or the Community Tracing Collaborative, we've said this before, be open and honest with them. You're not going to get into any trouble, you're not going to get a fine, but we just need to know what parties you've gone to, where you've been going. It will help you, it will help us, and we just want to get the information so we can get everyone safe, nip everything in the butt, and then that way it doesn't spread and we can continue enjoying having some semblance of a normal life until we get through this. And also, you got to follow the quarantine orders. So if you're told that you need to quarantine, you do need to quarantine. We haven't really had much of an issue with that. Maybe there's been 1 or 2 cases where it's been a little bit more challenging, but if you're told to quarantine, you need to quarantine. We know that that might cause an issue with some people if being able to pay their bills or feeding themselves. We will help you with that. We have resources to do that. But if you're told to stay home and quarantine, you have to quarantine. If you work in Norwood and you're told you can't go to work, you can't just go to work somewhere else. If the kids are told they can't go to school, we know that is tough. They need to stay home. But please call us if you're having problems in quarantine. If you are quarantined, we will be able to help you out.
And back to what I said earlier, we don't take it lightly. We understand the implications of putting someone in quarantine. So it's because it's protecting the public health, and that's why we do it. But that we take it seriously, and that we know it's a big burden on people, but that it needs to be done also.
All right. Sigal, any final COVID updates for this week? We appreciate you being here for going to the red just to make sure. Does anyone have any other questions for Sigal? And let me just check the comments. Yeah, the screen looks a little funny for some reason. Doesn't appear to be anything in the comments. Okay, well, as always, I can do my best to answer any questions, or you can email health@norwoodma.gov if you have any specific COVID questions. But we are in the red, and we want to let everyone know, and that state map will be getting released soon if it hasn't already. That'll show Norwood and another dozen towns have added or jumped into the red.
Yep, and our data report will follow that pretty soon after.
Okay, all right. Thanks, Sigal. Do you want to stick around for the rest of the live? We're going to talk about granite curbing and trails and...
Oh, gee, that sounds fun. I do want to hear about the trails. But no, I got to go look at that data report's posted. So
okay. All right. Thank you, Sigal.
Thank you.
And I agree, Catherine. Sigal is doing a wonderful job. And as soon as Sigal does leave the room, that means I get to remove my mask, which is helpful. Thank you, Sigal. So moving on to a couple of other updates, I did mention trails, and there will be a trails cleanup, I believe, on Halloween. Joe's going to get that, and thank you to Joe for posting, producing this week's meeting. Thanks, Gal. We're going to get that on the posted in the comments, and it's a trails cleanup. And Joe Greeley and his team in the Trails Committee have done a great job really promoting trails in town and promoting the use of trails. We'll actually be looking to do a lot more trail signage and notification in the next upcoming years. It's been great as they've done these. They've really gotten the information out there for the trails, and people have realized how many walking trails and walking paths we do have in Norwood. So kudos to Joe Greeley and his team. I believe we've got the event there up on the trails cleanup. I do want to apologize. I was supposed to mention that last week, and I did forget, but we do have it here. I want to talk for a minute about school meal plans and two things. One, once again, thank you to our wonderful cafeteria workers for the shirt and for all the work they do working every single day of this pandemic. Free school meals are still available for school-age children in Norwood, whether you're in school doing hybrid or doing remote. The grant's been extended at least through, I think, the end of the year or through the it might be the end of the fiscal year as well. So if you have a child in Norwood, you can get a free lunch through your school. We're going to get that information. Yep, the trail cleanup's on the 31st. We're going to get that information posted in here in the comments. So please, please, please take advantage of the school's meal programs. It costs you nothing. It actually helps the lunch program because they get a little bit of revenue from the government from each one that they, each meal they give out. It does not take a meal from anyone else. So it's not, gee, I took it to somebody else and need it. They could produce as many as we need. They've some weeks produced thousands of meals. They have literally fed thousands of people since this began. It's what they do, and they're great at it. You are not, if anything, you're making their job easier and more fulfilling by getting lunch. And it's for any kid in Norwood who's school age. It's not just Norwood public school students. So that could be a student that goes to St. Catherine's, could be a student that's homeschooled, or perhaps goes to a charter school or somewhere else. We have posted the menus up there, and there's no paperwork to fill out. You just need to visit one of the sites to get 7 days of breakfasts and lunches. So that's the other thing. I guess breakfast is included as well. So you can go to the grocery store and spend your own money, or you can go get a school breakfast and lunch for your kids for free. There's no questions. They just ask that you be a student of school age in Norwood. So you can go. Somebody can pick up for you. So that way, if you have to work and you have your two kids home and grandma and grandpa's watching them, they can bring the kids. They don't even have to bring them. They can go and pick up the meals at the school. So we encourage everyone, please, please, please take advantage of this. It is effectively, it's free food. They do a great job. The food tastes great. Reduce the burden while you can on everyone and help out the school lunch program at the same time. In addition to the regular meals program, beginning in November, for a period of time in November and December, we're bringing back our weekly family meal program. So we debuted this last year when COVID started, and it was a series of weekly family meals. So you can actually get a family style meal. It might be a chicken parm, it might be spaghetti and broccoli, from the schools once a week if you have students in the school department. You need to sign up for it. We'll get the information in here to sign up for it. It's a once-a-week family meal program. Many of you will remember this from last year. It was very successful. We served around 400 families each week that we did it, so that's a couple thousand people that benefited from it. It is no cost. We're able to use a combination of donations and grant funds to cover the cost, as well as Norwood Bank helped us out this last year and this year with the donation for it. It is a free family meal. They're delicious. And it helps out the schools. It helps out the lunch program. It's not taking food from anyone. It is free. It'll be, I think, 3 weeks in November. And we just encourage everyone to be able to take advantage of it. Question from Amy about, is there a way to have lunches delivered to St. Catharines every day? You know, we can look into that and see what we can do with St. Catharines. I don't know if there's any regulatory issues. The only challenge might be because you have kids from other towns, if they're not able to get reimbursement for it. But I think that would be a great idea. That's certainly something we can look into. If you do have kids at St. Catharines, you still can pick up the lunches. It probably couldn't pick them up and bring them to there because they're in full session, but it's always a possibility as well. Monday, Wednesday, Friday at Balch Elementary School and Norwood High School. Children of any age under 18, they do not have to be in school. Hours are 11 to 1. Diane has posted the lunch, breakfast and lunch pickup time. So we encourage you to take a look at that. And Amy, we will absolutely look into whether or not we can do something. Oh, Diane says they're already looking at it. See, that's how great these cafeteria workers are. They're already working into it and already looking at it. They're there every day working for us. And again, I can't stress this enough. When most white collar workers, and I'm one of them, of course, I kept going to the office, but most white-collar workers were told, go home and work from home, stay home for a while. Our cafeteria workers worked every single day of this pandemic, up to and including today, and they'll continue to, and they deserve all the credit in the world for that and for feeding thousands of children and even families. That weekly family meal program is a Norwood program. You don't see it anywhere, and I don't believe there's any other town in the country that has done that program. So kudos to Diane and Eli and the entire team over at the Food Services Department for what they've been able to do. And please take advantage of the meals. That's all they ask, is come get the meals that they're preparing, and it helps them and it helps everyone else out. So school meal plan, we've talked about that, and we're going to continue looking into whether or not we can do something with St. Catharines. So a couple other items I want to talk about. The election, the all-important election. This is likely to be one of the most important elections in our history. And we certainly know that there's a lot of contentious politics around it, but what we're focused on here is making sure that the election is fair, that it's safe, and that everyone is able to vote. We have early voting available through October 30th. So you can early vote through October 30th. We will get it's been posted on social media. We'll continue to do so. It's on our website, and we'll get it posted here in the comments, the actual schedule. It varies a little bit day to day, but all you need to do is come in and vote. They take care of you. We've been doing robocalls. Interestingly enough, if anyone has gotten the robocall, you can A, let us know that you've gotten the robocall, or B, in the comments, let us know if you got the robocall, and encourage you to actually go out and early vote, because we'd like to know whether or not those are just sort of annoying people or whether it's reminding people to go out and vote, because we're going to do a few more of them. The last day to register to vote is October 24th. So that's the last day to register to vote for this election. Unfortunately, I've been working election polls for really since I was 18 in one capacity or another. There's always people who show up on election day and want to be able to vote and are unable to because they haven't registered to vote. So please, if you haven't registered to vote, you need to register by October 24th. Please register to vote. You can do mail-in ballots. The last day to get a mail-in ballot is in the information. We'll post that in the information. The last day to request a mail-in ballot, you need to request it by a certain date. If you can't request it or you choose not to, you can early vote. You can early vote if you have requested a mail-in ballot. They do keep track of that. It's a little bit more work for the clerk's office. So if you've got that ballot at home, it'd be helpful to send it in. You can mail it in, or you can drop it off in either of the drop boxes at Town Hall. But if for some reason you spilled coffee on it, you can still come in and vote. Do the early voting. Now, what if you don't like the mail-in voting or you don't want to do it? You can't get there for early voting for some reason. You can still vote on November 3rd, and please do. We encourage everyone to come out. If you haven't voted, come out and vote on the election. We'll have PPE. It will be a safe election. There's plenty of poll workers. We're putting a lot of resources into it. I can't tell you how hard Mary Lou Folan and her team in the clerk's office are working, and we are backing them up with many financial resources and staff from other departments and everything they need, so that way we can get ahead of things and stay ahead. They're in every day for the early voting. we've already seen a turnout of about 25%. So think about that. We always talk about what's the turnout, how, it's already at 25% and the election isn't until November 3rd. And it's all Mary Lou and her team who are doing that, and we're backing them up. Chris and Adeline, interns from my office, are helping them. We've had Sharon, my executive assistant, help them. We've had Debbie Frangioso in the planning, the billing department, help them out. A number of other election workers. So we're putting all of our resources into the election to make sure that they're caught up, that they're doing everything they can do, everything is filed, and that we're making sure we're serving all of the voters and taking care of everyone. So this, I can tell you, with the complexity, not just with COVID, but between early voting and mail-in voting, this has been the most challenging election probably in the last half century, if not ever. And through November 3rd, it will continue to be the most challenging election we've seen. There's a municipal clerk's appreciation week or something in May that seems to be there, but we're going to have an official town clerk day at some point in the winter, and it's all going to be to celebrate the staff in the town clerk's office because they deserve it. But the bottom line is please, please, please vote, whether you vote through early voting, whether you vote through mail-in voting or showing at the polls. Vote. There are a lot of people who have sacrificed a lot so that we have the right to vote, and there are people working day and night, 10, 12, 15 hours a day just so that we can vote. The post office has been great too. I want to mention that. They've helped us out with a large volume of mail, so they're in it to win it as well. There's so much effort going into this election, and all we need you to do is to just come out and vote. So kudos to Mary Lou and the elections team for everything they're doing. Hi, Kate. We appreciate the comment. Appreciate Tom helping us out at Town Hall as well, helping cover the desk the days that he does. It's been challenging to have Town Hall sort of open by appointment and doing the early voting. This has been an intense period for a lot of the Town Hall staff, and I'm certainly grateful for them and the work that they do. Joe has posted the early voting information. Please, please, please vote. I can't say that enough. I don't want to sit here for 45 minutes and just say please vote, but if I did, please, please vote. I want to let everyone know, I got a question here I'm going to go into in a minute. I also want to let everyone know there is a rental assistance program available. We've been able to work with the state to get some grant funding. Kudos to the planning department for getting that grant funding to be able to do some rental assistance. We're going to get that posted in the link. We've been putting it out on our social media as well as on our website. If somebody is struggling and needs some rental assistance, there is some information, some resources potentially available there as well, and we hope folks will take advantage of that as well. So I have a question on granite curbing, and I'm going to pull up the response we have here just so we can make sure I get it right. But the question was, in brief, how do we decide what streets get granite curbing and what streets don't get granite curbing? So it's a combination of a couple of factors. On the one hand, one of them is cost. It can almost double the cost of paving a road when we do granite curbing. So cost is a factor. We've always focused on the more dense parts of the community for the granite curbing, usually starting in the downtown and sort of working its way out from there. That cost is a factor, but it's also a really sort of wide subdivision road that's got plenty of space. The granite curbing wouldn't really be appropriate for something like that. So it's a case-by-case basis. If you think of, I always call Lower Nickel Street. That's my own definition of it, but it's Nickel Street as you're closer to Manhattan. That's a real narrow road. Nobody's going to be able to park there. You don't want anyone parking there. It connects to the wider transportation network in town, or the wider network of walking streets in town. You tend to try to have your best sidewalks where people are walking the most. There's a couple other considerations as well. Where we do that Cape Cod berm, which is just sort of the concrete, the asphalt that sort of looks like this, it's a little bump. That's designed to be parked on. So that's designed and reinforced in a way that the plows won't chew it up too much. And it's designed for a wheel to go up on over it, intentionally. Some people say, oh, they're just going to park on the curb. It's designed for an area where you may do that. So a street that might have a lot of dense housing or a lot of multifamily housing, but has room for people to park on it. Now, that part of Lower Nickel Street, you're not going to park in the street. I've probably seen an Amazon van parked there here or there, and they're not supposed to, but you're generally not going to have people on street doing on-street parking. It's also what we try to do. If we had a preference for every street, it would actually be to do that Cape Cod berm with the green strip. Now, some people ask, why do you have a green strip? Why can't we just have granite curbing? Well, the benefit of the green strip is a couple of things. One, it's attractive. It's greenery. It's nice. We could eventually plant something there, even though we can't always keep up with them, and the grass usually doesn't get too long. It also helps reduce our impervious surface. Now, what that means is when rainwater hits, so stormwater hits, and we know after the June 28th storm that stormwater and storm rain damage can cause substantial damage. The less impervious surface, so the less paved surface you can have, the better it is for that water to just go naturally into the ground and into the aquifers. So anywhere you can add green space like that, it's helpful when you can do it to help with drainage as a whole. We don't want our stormwater system absorbing all of the rain. If you can have more green space available, it helps with that draining of the water. So if you have a road that's wide enough to be able to do it, we'd always like to be able to do it. Now, every road, sometimes there's a case-by-case basis. In some streets, folks have really requested granite curbing, and, you know, it's sort of on the line whether you can do it. We ask if they're willing to cost share. So the person who sent me this question, if you're watching, I'll make sure to send you a little bit more of a detailed answer in writing, but that's really what it is. It starts sort of in the urban core of the town and then moves out from there. We look at price. We look at what's the road used for. Is it people parking? Are people likely to park on the streets? Do people have enough driveway parking? If we can put some impervious surface in there, we'd love to. Using that portion of Nickel Street as an example, and you know, Nickel Street changes as you get down the farther end of it, but the street, portion of the street closest to Manhattan, we could never do a berm and a grass strip there and still have a sidewalk. It just wouldn't likely happen. So the granite curbing is also not as good for plowing. Believe it or not, that Cape Cod berm is actually better to have to plow around. More modern plow blades, say that one 3 times fast, actually on the corners will pop up a little bit when they hit a surface. So a modern plow blade hitting that Cape Cod berm, the little pieces here kind of pick up and nothing really gets damaged and we don't have to go replace it. It's also, because that's all single formed as part of the road, it's more stable and it's actually easier to repair. But that being said, if we had $10 million a year to spend on roads and sidewalks, we would. We'd like to increase the overall amount of granite curbing because it does look good in a lot of neighborhoods. But for every street we have where half the residents want granite curbing, we often find the other half like their green strip. So we sort of get stuck in the middle of it and just say, well, what's been here and what can we do? With the goal always towards the green strip with the Cape Cod berm just allows a little bit more where we can water infiltration. I have some folks who hate green space in front of their walkways, and I find that strange, and they demand, and they're adamant that it get paved, and I think it looks terrible. So sometimes you may want something for a street, and you may like the look of a whole street being a certain way, and then your neighbor is, oh my God, I don't want it all to look the same. Those are some of the challenges we deal with day in and day out. It's like trees. When people don't want us to trim a tree, they are certain that it's their tree on their land, except that when it starts to die and it has a problem, we get a call and they say, oh, the town tree's dying and you need to come trim it. And it's, well, 2 years ago, it was certainly was your tree, but that happens. So the long story short of granite curbing is we look at cost, we look at what's already there. We look at our goals always to decrease the amount of impervious surface where we can, and then sort of what the fit for the neighborhood is. A lot of dense housing with multiple units makes it tougher to do that Cape Cod berm if people are going to be, you want that for people to park, but people aren't as able to likely to park on that street, especially if it's not enough space for us to plow on. So, but if you have specific questions about your street and when it's up for paving and what the decisions are made, you can always let us know. You know, we're looking at seeing if we can formalize a policy on when we do granite or not granite, but the challenge is it really is a street-by-street decision based on what we have and where we are. And just because some street may fit that decision doesn't mean we're going to go put curbing in there unless we're then doing that sidewalk over. And sometimes we prefer to just overlay the road and do next to nothing with the sidewalks because we can do more roads. So it's a catch-22 about balancing our resources. Do we pave 3 roads and make them look really good with granite curbing? Or do we pave 6 roads and the sidewalks just look okay? The goal is to pave the road. So it's all about, those are the discussions we have all day, every day about what are we doing here. The DPW is very thoughtful about the decisions that they make and the recommendations they make. We are proposing to town meeting to do a series of road bonds over the next 5 years that would end up increasing the overall amount of road work that we're doing, as well as water work. I think I've shown before here what a lined versus an unlined water pipe looks like and why we want to try to address as many of the unlined water pipes as we have in town. Just for anyone else to know, this is what a lined water pipe looks like. So your water flows through that. And it's perfectly safe to drink, but if we don't line the water lines, this is what they look like. Now, it's not a health issue as much as it is a reliability issue. It's a turbidity issue. It's a little bit about the look of the water, even though it's still clean to drink. And also the flows, which are a big deal for fire in particular. So if you have low water flow in a neighborhood, it's a particular concern if there was a fire in that neighborhood. So I bring that up to point out that we're trying to do a lot more infrastructure in the next 5 years than we have in probably the last 20 or 25. And maybe it's too aggressive, but investing in roads and good water, good clean water, and working sewer systems and working stormwater systems are the best dollars that we can spend for us today and for the future of the community. And really, that's the only way you're ever going to combat climate change. I think part of it's adapting to climate change by accepting that there's going to be more storms, there's going to be more rain coming, and better quality infrastructure is the way to handle a lot of these challenges that we're facing. Even though I know we all hate when the roads get dug up, and we hate when we don't get the right kind of sidewalk, and we don't like when we have to deal with the metal pipes across our street because we're cleaning the water lines. I know those things stink and nobody likes them. It's the downside to getting work done, but good clean water that works, sewers that work, and I know road paving is a pain when it's there, but there's nothing nicer than driving down a nice clean, recently redone piece of blacktop. So that's our question on the granite curbing. We've talked about our COVID data, and unfortunately we are in the red. We've talked about the rental assistance program, which we've popped there. Thank you, Katie, for watching the live. We appreciate everyone watching these every week. We've found them a good way to get information out to a lot of people. And I did thank earlier, but just for anyone who is recently joining us, I want to thank Athena Alexopoulos for my mask. She's a Norwood High student, so thank you for the mask. And I think that gets to the end of the questions and comments I had, other than I'm going to talk about town meeting for just a moment. Town meeting is scheduled for November 12th. Next week on Wednesday and Thursday, we will be doing some information sessions and Q&A. We're going to get that information out tomorrow. Those will get recorded, so they'll be replayed, and then there'll be an informational video released about a week ahead of time, meeting by the FinCom, School Committee, and Board of Selectmen. The warrant has gone out to town meeting members. Sometime tomorrow afternoon, what we call the yellow sheet, which is sort of an explanation of everything that's on the warrant, will get posted on the website, and all the different documents for the capital plan and everything else is all going to be on the website as of tomorrow. And if you can't make those information sessions, the Q&A sessions, you can always ask questions here at one of the lives. We might do a Facebook Live town meeting Q&A session, but you can always email us anytime and say, hey, I got a question about this zoning article or this item on the capital plan, or, okay, we're spending money on this. What does this mean? You can always just email us, and we'd be more than happy to answer any questions you have about anything on the warrant. But that information will be going out to town meeting members in the next couple of days, and we'll be doing a big sort of dump of all the information onto our website for tomorrow. Town meeting starts on November 12th. We mentioned earlier, Sigal talked a little bit about Halloween. We do believe Halloween can be done safely. We just ask you to do that. Be safe. We know what safe is and what safe isn't. If you're quarantined or tested positive, do not participate in Halloween. No parties or haunted houses. Try to put the candy outside in a tray if you can to reduce the contact, and wear masks. And again, I make my joke every time, wear a mask like this in addition to your Halloween mask. And if you don't feel safe participating, simply don't participate, and there's nothing wrong with that as well. All right, we've reached about 52 minutes. I've covered the agenda I have. I'm in our beautiful Norwood Light headquarters. I don't know if anyone's here yet, but there's a boardroom in here that I really like using that I've decided to name the general manager's boardroom. Of course, once COVID hit, we stopped going into different buildings and try to reduce how much we're here. But I think if anyone hasn't seen this particular boardroom, it's kind of it's got a big fancy TV. It's got a nice big table. That's why I like it. I like to sit at the head of the table. But we're here at the Norwood Light headquarters, and we certainly appreciate all the town employees and the volunteers that make everything happen, especially Norwood Light for keeping the power on and for everything they do. And they actually did our IT setup for this meeting. So special thanks to Colin and Nate and Jason for helping us out with that. With that, does anyone have any other questions, COVID related, or on any other items of town business that we can answer? As Joe said, you can always email us questions and complaints, concerns, compliments as well. If we can, we'll always help you out if we can. If we don't get back to you, feel free to just buzz us again with an email. Thank you, Kevin. And I also want to thank Kevin Shaughnessy for helping us out today. He just walked by, so my guess is I forgot to mention Kevin. So sorry. Kevin's longtime light department employee. They're all good employees. So with that, one last shout out to our fabulous lunch ladies, the cafeteria ladies in the Norwood Public Schools, who have worked every single day this pandemic and everything. We appreciate everything they've done for us and feeding thousands of children day in and day out. With that, I hope everyone has a great weekend. Please stay safe, make smart decisions when you're out with folks, and try to maintain your small circles and continue to support local businesses. We are in the red, so please, please, please be just be cautious of that and just be smart about what you're doing. And I want to thank everyone for all their support, and shout out to the clerk's office and everyone else. I have trouble ending these. I get a little better at it. But thank you, everyone. I hope you all have a wonderful weekend. And again, any questions, feel free to always just email us at managers@norwoodma.gov. Thanks, everyone.